Good afternoon, everybody. I'm Nick Rishwain. I'm the Vice President of Client Relations and Development for Experts.com. And this blab is brought to you by Experts.com. With me today is one of our members, Nancy Zangmeister. Nancy is a registered nurse and a certified life care planner, as well as a certified Medicare set-aside allocator. She's got experience with workers' compensation, medical case management, and vocational rehabilitation case management for self-insured employers and state fund workers' compensation. And with that, Nancy, I know that that's very brief about what you do. Maybe you can expand on that a little bit for us or for our listeners.
Thank you. I'm glad to be here. I appreciate this opportunity. My main focus in my business now is writing life care plans and being an expert witness for attorneys. Insurance companies also request life care plans in order to set reserves so they know how much to put aside for a workers' compensation case or an insurance case, even without litigating. That's my passion. I love writing life care plans. I do also write Medicare set-aside allocations for workers' comp and liability. So those are the two areas right now that I'm focusing on. I had spent 14 years as a case manager, and I'm kind of easing out of that a little bit. It's been a long time doing workers' comp, so it's time to move on. But,
right. Can you tell us, for the attorney or even the layperson who may be watching, what does a life care plan consist of? What and how does one come about, maybe?
A life care plan is it's a report, it's a roadmap for a person who's sustained a catastrophic injury. Most of the time it's for medical malpractice or some type of litigation where the attorney needs to know what it's going to cost to take care of this person for the rest of their life. So essentially the life care plan looks at the person, reviews the medical records, meets with the individual, gets a history, finds out where they're at now, what they can and cannot do, their limitations, and what their needs are. And we, as a life care planner, compose a report that actually shows what this person is going to need medically, equipment, any kind of follow-up, housing adaptations, and we put a price to each of those items to come up with a bottom line number so the attorney knows what they're going to need to be taken care of.
Okay. All right. So, and is it only for some sort of a catastrophic disability or a life-changing type of disability when one of these would come up, a life care plan?
Yes, I think with other cases where they're looking at bottom line numbers or care needs for somebody that's not catastrophic, maybe a failed back injury, we would do what we call a medical cost projection. The medical cost projection is not used in court, where the life care plan, as an expert witness, I could be deposed on my life care plan, and I could also be an expert witness at trial defending my life care plan.
Okay, and then it was good. That kind of led me to my next question about. So you would come in either for plaintiff or defense, I'm assuming either one, right. Mm-hmm. And you would create the life care plan. They ask you to do it, and they have all the information for you, the medical records that you need. At what point do you have to come to deposition or testimony? When does that come? You have to defend your plan. Is that generally how it comes up? Or do you have to go in and explain life care planning to the jury as well?
Well, it seems like a lot of cases anymore are settling, so I've not been deposed in a little while. But if I am deposed, I would be going up against the opposing counsel. If I go to trial, it is I am a trier of fact, so that I will be educating the jury primarily on what this person needs. So the jury would be who I would really be talking to and teaching.
Okay. All right. So, and generally explaining how you came to your conclusions in the plan that you created.
Correct.
Okay. And so plaintiff would be in a personal injury or I guess in certain workers' comp cases, as you had mentioned, but probably personal injury or medical malpractice on the defense side, you'd be working for the insurance company or in their counsel.
Right, the attorney would hire me, defense attorney. I do have a case currently that that is being brought to by an auto insurance company, so they're who I'm representing. But it's mostly the attorneys that will hire me and who I work directly with.
Okay, all right. And as far as injuries go, what type you've done life care plans for, I'm sure, a wide variety of injuries.
Right.
And can you tell us what types of injuries?
The majority of my life care plans seem to be spinal cord injury and brain injury, and I am a certified brain injury specialist. I obtained that certification last year. I've also done a plan for a heart transplant, which was my first one, and it was a really interesting case. It was very involved, but it was a good case. I not only had to determine what he would need if post-transplant, but I also had to determine what he would need should he not have a transplant. So it was kind of a two-part plan, which was really, really interesting.
Because it would change if he had the transplant or didn't have the transplant, would change the level of care that he needed.
Absolutely, and the life estimate. The life expectancy, because without a heart transplant, the life expectancy is less than if he were to have a heart transplant. We hope that everything goes well if they have a heart transplant. So.
Interesting. And have you done anything? So we've got brain injury, spinal cord injury plans, the heart transplant. Have there been others major? I guess in my mind, the spinal cord injury would seem like it was a very common thing, but that's just in my mind. Is it very common? Okay. Mm-hmm. Are there any other issues where you would, any other catastrophic injuries where you would be involved?
I did a amputation case. It was actually a 12-year-old little boy who lost his foot. And that was interesting too. There are a lot of amputation cases, upper and lower extremity cases. I had a case one time where a worker was electrocuted and he lost both of his arms at the shoulder. So that was another really interesting case.
Interesting. Yeah, that is. I didn't even think of amputation. Wild. Tell me how you got to this point. We show on your profile that you are a registered nurse.
Yes.
And that you did that you were a staff nurse on a rehabilitation unit treating brain and spinal cord injuries. Is that where your nursing began and how you continued nursing, or tell me where it began?
Well, I actually have had interesting, unrelated to life care planning. When I initially started my nursing career, I was a cancer nurse at Ohio State University right out of nursing school. I also have done home health care. I have done utilization review where I've monitored charts to make sure that policies and procedures are being followed correctly. And I've done case management for a managed care organization. And that's where I learned about life care planning, and I just fell in love with it. I really love the concept. I enjoyed just the whole thing, the whole part of writing life care plans, the challenge of coming up with these plans. And so I started my own company in 2004 with the intent of mostly writing life care plans. However, we fell into vocational case management, and I did the majority of my work up until last year was vocational case management. But now I'm focusing on life care planning and Medicare set-asides.
Okay. And how long were you on the rehabilitation unit as a brain injury nurse? How long were you doing that?
I did that for 6 months, and the reason that I did that, I was at Dodd Hall at Ohio State. I wanted hands-on experience of the brain injury and spinal cord injury because those were the cases that I was seeing the most of, and I wanted to actually be in a facility that treated those illnesses or injuries so that I had more personal experience.
With the care that is necessary in such a case. Interesting. Okay, so it's been a variety of things that kind of led you to the life care planning. What was the need that you saw? What is the need that you saw? Let's talk about for just a few more minutes the litigation side. Is there something that triggered you to get into the life care planning for the brain injury and the spinal cord injury? In the litigation side, is there something that you thought, well, what kind of motivated you to get into that? What was the interest or the thing that kind of sparked it that you were interested in doing those? If there is one thing.
I'm not sure. When I first started doing life care plans, I was doing them at the managed care organization that I worked for, and I was doing them for the workers' comp arena. For the Workers' Comp Bureau because they wanted, again, to set cost reserves. So I did over 50 plans for the Workers' Comp. And then when I started into my business, I have still done some for Workers' Comp, but mostly for the attorneys. Those are the cases that I feel really need the life care plan because their cases are so catastrophic and so just life-changing, and there's so many needs. So
it really came from a point of caring. Essentially, you saw a need had to be filled, and that sort of drove you into it.
Right.
Yeah, very cool. And what is? I mean, if I'm a 40-year-old man who gets a life, God forbid, a life-altering catastrophic spinal injury, is there, let's say I'm in relatively good shape and relatively good health, no drinking, no smoking, is there a general idea of how long somebody like that might live? And maybe you have to add to the hypothetical in order to explain better what I'm having trouble explaining.
Life expectancy is affected by catastrophic injuries and disabilities, and depending on what the injury or the disability is, depending on the complications that the person has, we look at the complications that they've experienced in their first year post-injury as kind of a roadmap of what they may experience in the future.
Okay.
If I have a question as far as life expectancy, if I feel that the life expectancy is going to be reduced considerably, I do have someone that is an expert in determining that life expectancy. Normally, we just go by the CDC life expectancy chart for the age of the person. But like I said, if there's going to be a difference in the life expectancy because of the injury or the illness, then I have someone that looks at the medical records and comes up with what we call a rated age, which is different than the normal population.
Okay, and that's a good. I was confusing the two, the life care plan and the life expectancy, and you made clear one thing that we always like to make clear for our experts, that you don't opine on something that is not near area.
Yeah, it's not my area.
So, and I'm glad you covered that, because I kind of confused the two in my thought there. What is somebody looking at? Let's say it's partial paralysis from the waist down. What kind of care are they looking at in their life?
Well, we're not just looking at medical care, although that's a big part of it. Future doctor visits, visits to a spinal cord rehabilitation ongoing. We're looking at wheelchair needs. We're looking at home modifications. You know, is their home accessible for them? Vehicle modifications, can they drive, and what kind of changes do they need made to the vehicle? And what other equipment? You know, are they using a catheter? Do they need, you know, catheter supplies, or do they have a tracheostomy and they need trach supplies for the rest of their life? So those are the things that we look at. We also look at, which is the biggest expense in a life care plan, is home health care. You know,
Okay.
we don't want to depend on the family. We don't know if the family will still be there. So we incorporate a plan for home health care to take care of the person. My big feeling is that I don't want the family to be the nurse. You know, I want the family to be the family. There's so much of a role change anyway, but you know, let the nurses and the home health aide do the things that they can do, and let the family get back to a more normal situation. I wouldn't want my husband taking care of me if something happened. You know, I want him to be my spouse, not my nurse. So it's very important to look at that aspect as well.
Yeah, that's interesting. And it's not something that, you know, I was thinking specifically medical care. Maybe it's common for somebody who's sort of lay to this area to think about the medical care costs, and home health care would be such a major issue.
Right.
And I like the way you conceptualize, let the family be the family and the nurse be the nurse. Because we've all, I think many of us have had family members who have had to take care of elderly family members, and it's a very difficult job as a family member.
The main goal of a life care plan is to return the person, the injured person, to as close as he was or she was prior to the injury, the day before the injury, to give them a good quality of life and to give them back their independence as much as possible. So those, and also to prevent future secondary complications. So those are the three goals: the independence, returning them to as normal as we can, and to prevent secondary diagnosis. Those are the three main reasons that somebody would benefit from a life care plan.
Okay. And a secondary diagnosis for me would be what I'm not sure.
If you're a spinal cord injury, do you have decubitus ulcers? Do you get frequent urinary tract infections? What can we do to prevent those things from happening, as far as, you know, a mattress, an air mattress on their bed, making sure that they're being turned, appropriate seating for their wheelchair, so we can prevent those complications. You remember that Christopher Reeves died from an infected ulcer. And those are the kinds of secondary complications that we want to prevent.
Okay. I did not know that that's what he died from. I thought, I just remember it being complications tied to his injury, but that is really that would be considered a secondary diagnosis.
Right.
Okay, that helps. That helps. I have changed the topic now, in case, you know, the brain injury is a big issue these days. A very big issue, as far as you've seen the movie. Maybe you haven't seen it. I have not yet seen it, but Concussion is out, in items like that. And we've seen a lot of people with questions about brain injury, and what is somebody going to expect. And at this point of the conversation, you know, feel free to expand on several things: your nursing, your not only your nursing, but your life care plans and your experiences with brain and spinal cord injury individuals. What is somebody? What are they suffering from a lot of times when you see a brain injury case? What would they expect to be dealing with? And
Well,
it
there's
depends on the injury, I'm sure.
yeah, there's a wide variety. I have a case with a 21-year-old who was hit by a car who's in a vegetative state. We're never sure how much they are really aware. He doesn't seem to be aware of anything. And you have people that have just mild brain injury where they just have some memory issues. So there's a big spectrum. It's interesting, the CTE with the football players is becoming a hot topic. A couple of years ago, I attended a conference for the American Association of Nurse Life Care Planners, and we had a football player who had suffered from CTE came in and spoke to us. And it's very interesting, and it's actually kind of scary. And you think about the young kids in high school getting concussions over and over, and what's going to happen to them when they're an adult.
Yeah.
It's cumulative, so it's a scary thing.
Yeah, and with the brain injury, it can happen essentially at all ages, just depending on what occurs, right? What are the most common injuries that may cause a brain injury, or most common injuries that you're seeing?
Automobile, falls are a big thing, and interesting too, you think about somebody with a spinal cord injury could also have a brain injury associated with that if they fell on their head. But probably falls and automobile accidents would be the majority. Trying to think of cases. I had a med-mal case where a person had a hypoxic or a low oxygen level in the hospital and suffered a brain injury and became into a vegetative state. So while that's probably more rare than the other causes, but hypoxia is definitely another cause.
Yeah, interesting. And I'm assuming that certain injuries occur from at different ages. Do you see more of the falls and things in an older demographic than you see for the middle age and young adults?
Right. Spinal cord injury is more common in men, males between the ages of, I think, 16 and 30, something like that, more of the younger male group, because they think they're invincible and they do stupid things. And then the brain injury could affect more of the elderly because of falls or bleeds, that kind of thing. So,
Okay.
Yeah.
And I feel like we should probably cover it, even though it's not it's kind of what you're getting out of it at this point. But maybe we should talk about the workers' compensation and what your experiences in workers' compensation matters.
Well, the workers' compensation, again, I started out as a telephonic case management where I just managed cases, making sure that the workers were getting the care that they needed telephonically. And then I went into vocational case management where I actually meet with the workers, attend some of their therapy sessions, go to their doctor's appointments with them to move the claim along to help them and make sure that they're getting the services that they need in a timely manner. Working with the insurance company or the employer to make sure that they are aware of what's going on. And as a nurse, to advise them on what I feel the person needs and what would help that person the most. Even if I'm hired by the insurance company or the employer, I still feel as a nurse that I'm an advocate for that worker. And I want to be fair to that worker too. I'm not going in and saying, well, you have to go back to work because your employer wants to go back to work. I'm looking at it medically and what they need so that they can get whole again from whatever their injury was in workers' comp.
Okay. That's an interesting way for me. I was thinking that your role in that would be for the employer, but it is in a medical role and you're still looking at it clinically.
Right.
Okay. And expand on, because this is something I'm sure some people have some knowledge of. I have zero knowledge of it, even with some past dealing with Medicare in another job. What is Medicare set aside? What is that all about?
That's an interesting area too that is becoming more popular. Medicare sometimes has paid for medical care related to workers' comp injuries, say, which isn't fair to Medicare, and Medicare is hurting financially anyway. So they have devised a program where, say, a workers' comp claim is settling. Okay, instead of giving that worker his money, whatever the settlement is, to go out and spend it on whatever, they are required now to put that money aside to help pay for their future care related to that workers' comp before Medicare will kick in. So it's kind of similar to a life care plan, but it's not as involved. We review the medical records and determine what that person is going to need for the rest of his life to care for that injury. Now, they're not usually catastrophic, but it's only based on what Medicare is going to cover. So okay. It's the items that they need that we feel that, or that we know are Medicare covered. And so again, it's a bottom line number. This amount of your settlement needs to be put away for your care. Okay. Once that money's gone, then Medicare will kick in, but Medicare doesn't want to be primary on paying for this care.
I see. So look, we're going to get to having to pay. There's going to become a time where we as Medicare are going to have to step in, but we don't think we should be the primary responsibility here until a certain time.
Right.
Okay. All right.
And it's only if it's kind of confusing, but it's only if they're already a Medicare recipient, or they're going to be a Medicare recipient in a certain amount of time in the future. It's not for someone that's not a Medicare age. Okay. Interesting. The attorneys now are starting to get the Medicare set-asides done for litigation, although Medicare is not looking at those yet, but it's more of a, we better be smart about this, and let's make sure that this money is put aside to take care of these litigated cases as well.
Interesting. So for example, I'm 36 years old. I'm not within the age of Medicare. So if I had a traumatic injury, how would the Medicare set aside come into play there? Would they say, look, we're not even looking at this? Because would Medicare say, explain that to me? If you have a catastrophic injury, you're probably on Social Security disability, so you would be eligible for Medicare within a certain amount of time. So Medicare set aside would work for you. If you are a worker that had a rotator cuff tear, injured your shoulder at work, and you're settling your claim, and you're 35 years old, you do not need a Medicare set aside because you're not going to be Medicare eligible for a while. I gotcha.
So it's, but again, with the liability ones, it seems like they're, even though Medicare is not looking at the liability Medicare set-asides, we're still starting to do those as well.
Okay. So. All right. Without telling me the cases, without giving any identifiable information, what expense, what size, number wise, have you seen in life care plans ranging from this to that? Do they range from 100,000 to 100 million? Give me an idea of how that works.
I think my highest one was probably 28 million, and that was a person who had was in a vegetative state from a brain injury and had a trach, and had a lot of issues. So that was probably my highest. I would say 250 is probably low, but a spinal cord injury or a brain injury are in the millions, and that's kind of normal. If you look at, I was just looking at a sheet yesterday that I had that broke it down how much it costs the first year in a spinal cord injury is like $800,000, and then what it costs after that. Not as much each year, but you're still, depending on the life expectancy, if somebody's going to live another 25 years, that's a lot it's a lot of money.
Yeah, yeah, that's what I kind of was wondering. I imagined it was quite a range in there. I just wondered how significant. And now somebody in the 20 to 25 million dollar range, was that a young person who was expected to live for a long time, or was it just the severity of the injury in this
It was the
case?
severity of the injury. He was in his late 50s, I think, but he was also in a facility that was very expensive, and so the daily rate of that facility, again, instead of home health care, he was paying that facility rate, and that jacked it up substantially.
Okay, okay. What is the tell me about the human element, because we're about 30 minutes in, and tell me about the human element behind these injuries. What do you see in court? The family, not necessarily in court, but in your medical practice too. The families, how do they react to these traumatic events? I mean, I'm imagining there's a whole range of reactions and how they deal and how families deal with these things.
When I am on the plaintiff side, I am able to visit with the injured party and the family and see the home. Sometimes on the defense side I can, but normally they don't want us to. But it's sad. It's really sad when, somebody who's been vibrant and, a hard worker, and all of a sudden they have a spinal cord injury and they can't do anything. You just really want to help them. I had an interesting case of a person who was a spinal cord injury who was actually able to walk with a walker. And there's a new robotic apparatus that now will allow these spinal cord injured persons to stand up and use their hands and wheel around, and it's just fascinating. The technology that's coming out is phenomenal. So although I'm not extravagant with my plans, but I want them to be, again, independent and to be able to do some of the things that they were able to do before their injury. And it is sad. It affects the family tremendously, financially as well as emotionally, and especially, again, if you have a family member. This young boy that I have that's a quadriplegic, and his wife is taking care of him, and she's only 30 or 34, and she's his full-time caretaker. She's overwhelmed.
I can imagine.
Yeah, and she shouldn't have to be alone in that situation, taking care of this person who hardly ever gets out of bed. So it is very sad, and it does make you feel really good when you can help these clients, and they do get a copy of the life care plan, and I do make the recommendations that I make. I help, I give them ideas of who they can contact in order to get the items that they need to help them.
Yeah. Okay. So there is more that comes to it than putting the plan together in that matter. You're actually helping them to find some of the resources
right
that they need for the help that they need.
Right.
Yeah. That is. Yeah, that's one of those things where I can't really imagine it. At 34 years old, and she's full-time caretaker.
Right.
Yeah. I mean, that's horrific. Good for her. I mean, my hat's off to her, but it's one of those things that it's hard to imagine.
Yeah, you don't know. Again, that's why he needs home health care, because you don't know how long she's going to stick around, or how long. And she shouldn't be doing this. She needs the help. And God love her for wanting to do this and dedicating her time to him, but she has no life. And
right.
So, we have to look at the family too, because this does affect the family and,
right.
All those around them. So.
Right. Yeah. Now, I was just had a thought. Oh, when you were talking about the robotic thing that was helping folks to sort of walk again, have you seen some significant changes in the technology that are maybe affecting life care plans? Are you able to analyze that in any way? Like, well, if something changes in technology, we should be able to let them purchase this. Does that go into the planning at all? How does that work?
I'm pretty conservative in my plans. This was the first time that I've ever put a robotic, anything robotic into my plans. But after talking to the manufacturer and seeing the response from people who have tried this item, I just thought that it's just phenomenal. Two of my plans, they're paraplegics that were able to walk a little bit with help. And the one guy was losing that ability, and all he wants to do is to be able to get around his house and cook again and be more independent. And this is going to be huge for him because he will be able to go into the kitchen and he won't have to hold on to the item. It holds on to them, so their hands are free. So just imagine, instead of being in a wheelchair, you're standing up, which is better for your body anyway. It's better for your digestive system. It's better for your circulation. So again, we're going to be preventing those secondary diagnoses by getting him up. It's going to help mentally, which is huge, trying to give them a better attitude and get their independence back. So I'm excited about it. I see a lot of, the items that are out there and the advances. There's been more advances in amputations and prosthetics than anything right now, but I'm excited about the robotics that can help with the spinal cord injury.
Yeah, that is fascinating. We have one of our other members who is a robotics expert, and some of the things he's working on are fascinating like that. And just think to change somebody's life and giving them that independence is just fascinating to me.
Right.
The amputation in prosthetics, do you have to work those items into a life care plan often, or?
Absolutely. With an amputation, this 21-year-old boy, we had to figure out what he was going to need for the rest of his life. And, you don't just slap one prosthetic on him. So they're growing, so they might need 2 or 3 during their growth years. And then, do they need a water prosthetic so they can take a shower with their leg on? Do they need a running prosthetic? So there's all kind of different types of prosthetics that you can get for these amputees, and you have to look at their age and their activity level, and again, keeping them as active as they can be. The amputees nowadays they're very active, and they don't just sit around, and they want the most up to date. Although again, I haven't worked a lot with the robotic prosthetics, but even the normal everyday ones have come a long way.
Yeah, and I mean, when I saw it, the changes in the prosthetics seemed to be, unfortunately, as our country got into some wars, and we had people coming back, the prosthetics really started advancing. I felt like in the early to mid 2000s, and they were making. So I imagine now they're really advanced, and because you're right. I see far more in the news of and not that you're dealing with soldiers, but injuries. I'm imagining have some similarities there. You see more of them active, doing running and CrossFit type exercises with these really fancy prosthetics. So
right.
Yeah, I didn't even think about that it's probably a big change. Is there a change from 20 years ago with how active somebody with a prosthesis is?
I think so. They're more comfortable. They're more lightweight. I think there's probably a huge difference. And it's interesting that you mentioned about the war, because this war that we've been in with all the brain injuries, it's bringing a lot of that to the forefront, and it's going to help with research for even the general population and the amputation. So that's the only good thing you can say about war is I think it helps to further the medical research that's needed in certain areas. So
yeah, it's interesting. It's just sort of popped into my head when you were saying that, because I really do. I probably never paid attention until we chatted about it, but I know that I see a lot more of that activity these days. And normally it's in a story related to a soldier who has returned. That's how I normally see it. So interesting that it also is the same thing is happening with the brain injuries.
Right. Yeah, that's huge right now because of the IEDs. I think this is there have been more brain injuries with this war than any other one in history because of the IEDs. So,
Wow.
and again, it's a blessing that the research will hopefully be there. And the CTE with the football players, that's going to also open up a lot of hopefully research and care for that.
That's fantastic. I mean, that is, you're right. If you're looking at the silver lining in those situations, hopefully the medical research and the advances there will help improve the lives for the general public as well as those who are injured. What are some items? Oh, about an hour, or we're about 40 minutes in. I like to play.
Uh-oh. I lost you.
Around
are you there?
With a couple. Can you hear me now?
Yep. I don't know what happened.
I don't either. I seemed like it. One of my coworkers also texted me right away. She said, "I can't hear you," right at the same time you did. So, luckily, it was just a issue of refreshing. I can still hear you, so that's good.
Yeah, I can hear you. We're good.
So, yeah, I like to play around with an idea. At this point in the chat is what do you see happening in the future of life care planning? What do you see happening in the next, say, 10 years? Or any changes in your field? And maybe it's more in the brain injury and nursing issue.
Well, interesting. Obamacare, the Affordable Care Act, is changing things as well. On the defense side, they are talking about instead of awarding the entire, like, say, $10 million for an injury, they're now pulling out pieces of the life care plan that will be covered by insurance, since everybody has to have insurance, and lowering that amount, that final amount in the settlement. So I see that personally as a negative, because I'm worried about the care that these people are going to get. And, and I know we have to have insurance, but does everybody have insurance? So that worries me. But I don't know what's going to happen with the Affordable Care Act, and there's lots of layers to it, but that worries me. That's the one big thing that I see that could make some changes for these clients, these injured clients.
And that's one of those things that we haven't really seen the full impact yet, so we're not going to know for a while how that plays out. And what about if you were to advise somebody who wanted to go into nursing today? What would you advise if you're mentoring somebody who's college age? What kind of advice would you provide to them at this time in their career? They want to go into nursing. Is there an avenue in nursing you would direct them? What would you tell them?
Well, nursing has changed so much since when I was a nurse. And having just spent a night in the hospital, it's interesting that, when I look at the nursing that I did 30 some years ago, where I actually took care of people, and the nurses now don't really have the hands-on, which is sad. But there are a lot of opportunities in nursing. Nurse practitioners seem to be a huge thing now with nursing, and you can go into nurse practitioner. Once you go through the school, you don't need experience per se to study and become a nurse practitioner. And they're very valued in the physicians' offices because the physicians are so busy. Rehab is a huge area, getting involved in a rehab hospital with brain injury and spinal cord injury and getting experience there. What would I tell them? Not to go into nursing, but it's just not the same anymore. But it's a wonderful profession, and we have a lot to give, and there's a lot of different areas now for nurses. There are a lot of specialty areas, like there's spinal cord injury nurses, there are brain injury nurses, there are renal nurses and forensic nursing. There's just a ton of different specialty nursing practices out there that need nurses.
Right. Right. Now, you made mention, maybe a little bit facetiously, but I feel like I have to ask. You said not to go into nursing. Is there another healthcare field that you think would be more effective today than the nursing field? That
I was, half joking. I just think nursing has changed so much, and but there are things that you can, there are areas that you can go into. Now, you can't be a life care planner without some background, some experience, case management experience, or nursing experience. You don't jump out of school and go into life care planning. Okay. But there's a lot of areas, and like I said, if I were to go back to school now, I probably would be a nurse practitioner. I wouldn't, if I didn't have life care planning. I like the hands-on, and it just seems like there hasn't been the hands-on anymore with the nurses. So it's still a wonderful profession, but it's just changed.
Yeah. And it sounds like you have a big heart and have cared about the patients, and you sort of. That sounds like the part about the nursing that bothers you today, that there's a little less one-on-one with the patient.
Right.
Yeah. Right. And that's sad to hear. It's sad to hear, because at the same time, I've heard. Oh, I see. We've got Dr. George Cosmides has joined. He's regular on Blab and some of the others, other live streaming sites. We're just talking with one of our experts, Dr. George. Nancy is a nurse, life care planner. You're welcome to take a seat. We were just talking about life care planning and spinal injuries. If you have a question for her, please feel free to take a seat. I believe he's in chiropractics, but don't quote me on that. Okay.
There are physicians now that are also going into life care planning, by the way.
Oh, so, are there? Mm-hmm. No kidding. And is there a reason for that? Is there a reason you're seeing that?
I'm not sure. I'm not sure why they are becoming involved in it. I'm not sure. I don't know.
Yeah, it's one of those things that you're seeing right now. Mm-hmm. Yeah, and the life care planning, does that allow you to do some more hands-on than maybe nursing would allow you to do these days? Is that one of the reasons you enjoy the life care planning? You still get to have some patient interaction?
We have interaction. We don't do hands-on. Okay. So it's just an assessment and talking to the person and guiding that person. But we don't do any more I don't do any hands-on treatment.
But as far as patient interaction, is that maybe one of the things that appealed to you in the field of life care planning?
It is, and helping somebody, helping to improve their quality of life is huge for me. That's what I get out of it. It's interesting when I think about a life care plan, and in nursing school we learned how to do nursing care plans, which I hated doing. Okay. But a life care plan is an involved nursing care plan, which is interesting because I love life care plans, but I hated nursing plans. I hated having to do those. But as a nurse, we use our nursing diagnosis to help us to determine what that person needs. So it really is, if you think about it, it's just a expanded nursing care plan. Now, maybe not for someone who's in the voc rehab field and not a nurse writing life care plans. It's a little bit different because they don't use a nursing process like the nurses do. So, but it's interesting. I always think I hated doing those care plans, and now I'm doing them.
And now you're doing them in more depth. In more depth, it sounds like.
Yeah, yeah.
Oh, that's funny. And you had just touched on something that popped in my mind, and then I kind of lost it. But tell me about your. We all know we've got just a few minutes left here, but and when I pause the recording, we don't automatically go away, so we can chat for a second once I stop the recording. So don't disappear on me too quick.
Okay.
But tell me about your mock trial experience, because we all know that majority of cases settle. Probably 95% of cases settle, maybe more now than ever before are settling.
Right.
So you had a mock trial experience, which gave you a kind of a chance to brush up.
The Columbus Bar, I'm in Columbus, Ohio, and Columbus Bar Association had a continuing education opportunity for the attorneys, and it was a real case. I was able to write a life care plan for the plaintiff on an accident case, and he was actually there. We had a mock trial, and I was cross-examined by the defense and had to defend my life care plan and had a ball. It was very nerve-wracking, but I really enjoyed it and felt like I did a good job. I was able to defend my plan. The jury came back on our side and gave him much more than we had asked for. So it's very interesting. And the jury that we had were actually very well educated. There were four. Let's see. There was an attorney. There was a nurse. I'm not sure what the other two did, and then there were attorney assistants. They were learning how to. They were in school.
Mm-hmm.
There's another name for them. Pardon me?
Law clerk?
No, they were there. Not legal nurse, but
paralegal?
Paralegals. Thank you.
Yep.
There were 4 paralegals. So we had an interesting jury. But it was a really good experience for me to be in front of these attorneys and to show them what I could do, and for them to see my plan, and to have the plaintiff actually there. It was a really fun, nerve-wracking, but fun day, and I was really thankful for the opportunity to be able to do that. So
it's good practice, because that sounds like a really legitimate mock trial where you're being cross-examined examined by one and cross-examined by another.
Mm-hmm.
And that sounds like really good practice for it. And I hope that you'll be able to, at some time in the future, actually be in a trial, because I do think it is rewarding. It just doesn't seem to be the way things are going these days.
No, I actually talked to an attorney today. I had a luncheon with the attorney group, and he was saying that they're few and far between anymore. They're just settling. Probably a bigger chance of being deposed, but than to go to trial. But I'm ready if I ever have to. So
yeah, and and the nice thing about this, although we got only about a few people pop in and out, this video you can reuse, and if they want to see how you present yourself and how you talk, you've got a video now that you can use for that. Mm-hmm. Which I'm not cross-examining you in the video, but it allows them to see you, hear you, and the information you have to provide, and how you present, much like you probably got to present on your mock trial, but it's something that you can reuse this way. That's the nice thing about the recording.
That would be great. Mm-hmm.
Yeah, because when they look at a profile on Experts.com, then they call and they talk to people, and and so forth, they get an idea, but sometimes it just helps them to be able to see you talking and being an individual.
Right.
That's very helpful. And I want to close up about 4 minutes here, because if we keep it under an hour, just under an hour, it's easier to put the YouTube video together, and you can also post it to your Facebook much easier that way. So for those who may be watching the replay, which I might note, even if we didn't have a large viewing audience, live viewing audience, there are a lot of replays, and the YouTube video gets some clicks, and you can always email it out. Where should people go to find you and contact you?
I have a website. It's www.qualityrehab.lcplifecareplan.com. I have a Facebook page for my business as well, for Quality Rehab and Consulting Services. So those are 2 areas that they can find me.
Okay. So, and I have just posted the Quality Rehab LCP, and as this is a Experts.com sponsored, I'm going to let people know that they can find your Experts.com profile also in the chat there. And her contact information is also available on Experts.com, and you can contact her directly. Any last minute thoughts that you'd like to share with the replay audience?
No, I'm appreciative of having this opportunity, and look forward to working with many more attorneys and writing many more life care plans to help those individuals that need them. So.
Excellent. With that, I'm Nick Rishwain. I'm the Vice President of Experts.com, and today joining me was Nancy Zangmeister. She is a certified nurse life care planner and a registered nurse. Thank you very much for those who are joining or who are watching the replay.